Monday, September 14th, 2020, Fairfield Department of Health board meeting. Can we call the meeting to order at 7:38 p.m.? And Andrew, just calling roll. Maybe everyone who's here can just indicate that they're here so that we have it recorded.
Mary Francis.
Mark Hotchkiss.
Sally Connolly.
Henry Yoon.
Dance Cleary is on.
Andrea Flynn.
Jill, you there? We lose Jill.
All right. All right. Well, hopefully we'll get her back. We see her symbol start to look in, and we heard from her earlier. So great. Hopefully everyone had a chance to take a look at the minutes from the August 10th meeting. Are there any comments, edits, suggestions? If there aren't, if I can get a motion to accept the minutes from the August 10th meeting.
This is Mark. Motion to accept.
Great. Can I get a second, please?
I second.
Sally,
Mary
I'll
Francis.
second.
Oh, okay.
All those in favor, say aye.
I'm raising my hand on this thing. This is
Aye.
cute.
You know, we should probably be able to do that. All right. Any objections or abstentions? Okay, fantastic. Great. Why don't we move into the our Director of Health report?
Okay, so let's see. I can see if I can. I was able to share a minute ago, but for some reason my share button has disappeared. I'm not sure why. Andrea, are you able to make me a presenter? If not, I'll just keep going and see if my share button reappears at some point.
I'm sorry, I should have probably mentioned this ahead of time. Would everyone mind muting unless they're and just unmute to speak? Thank you.
So essentially, since the last time we've met, our efforts have really been focused on universities and public schools coming back and all the questions and conversations that needed to be had, all the clarifications, meetings and the like that needed to happen prior to those events happening. And so really, Jill and myself have been, and Jill to a larger extent, sort of exclusively dedicated to assisting in that regard. So we've had multiple meetings with members of the Fairfield Public School administration. We participated in, I think last month I shared that we participated in meetings with parents and with teachers. We participated in another WebEx conference with members of the Board of Ed, a lengthy Q&A session with them. We also had an in-person meeting in a very large auditorium with lots of social distancing and masks with all the principals and headmasters and the superintendent and most of the Fairfield Public School administration, just to answer any questions, go through some issues. But basically, Jill and I were there to answer every question they had. So we stayed there. We were probably there for an hour and a half answering questions from them until they had no more. But we wanted to be available to respond to those questions. We've both been working, but Jill predominantly in sort of the development of plans and procedures and algorithms to guide the schools through the decisions that need to be made, as well as the school nurses through all the decisions that need to be made in relation to a case appearing, procedures with special ed students to a whole variety of different issues. And so we've really have made ourselves available, 24/7 to the superintendent and his staff, and trying to respond to all their needs, evenings and weekends, and multiple meetings with them and calls and emails. In addition, we've been, Jill and I as well serve on the planning group for the town, which essentially reviews the policies and practices of the town. Things like, considering when they released guidelines for senior centers and libraries, we would review those and meet with the staff of the libraries and the senior centers to ensure that they're following the practices and that they have the resources that they need to do so, and just to review and provide guidance on their plans there. And so in addition, the planning group also reviews the variety of events that are proposed around town. And so we have a number of large scale events that we would meet with the organizers of. And for the most part, we've tried to discourage any large gatherings. We've, for the most part, said no to large gatherings on town property. And so that has been relatively well received in terms of enabling the organizers being willing to postpone or cancel events for this year. So that's been going fairly well. We've had meetings with the tragic death of the high school student in the car accident. We met with the pastors of the church there. They were concerned about the number of people that could potentially show up, and so we went over the procedures that they had put in place, and just to provide any comments on that, and everything went very smoothly. In addition, we've had a number of events that people were willing to cancel, including a lot of the 5K runs, the hot oil run, the Bigelow Tea run, the Fairfield Half Marathon, a number of fairs and festivals. So the town has been, and the organizers have been very good at assisting the town and trying to keep our numbers low, trying to limit these large scale events. We did, as I had mentioned in previous meetings, approve in June the concert series at the Green and the jazz series at the History Museum. And those events went fairly well, with some learning as we went along, where some of the more popular events with larger followings were transferred down to Penfield Beach, where there could be more distancing there. And we essentially decided after that series was over, they had requested to extend it into October and to have an Oktoberfest type of event with another concert. And we've declined all those and declined to continue the concert series. We did have a large proposal for a concert type of event in the train station parking lot, where they proposed some, several hundred cards with several hundred people there. And we asked them not to do that and told them you're not in favor of that. And so that was not happening. But so we've done a lot of those types of events and meetings through the planning group. And so we continue to do that nearly every day. I did have the opportunity to meet with the parents of the high school football team parents, as well as with the coaches and athletic directors, and the elected representatives and state senator and the first selectwoman outside on the bleachers at Fairfield Ward to talk about football. And essentially it's a state decision that whether or not this would happen. And so they essentially were seeking guidance of, what would it take to convince the state? And so we provided some guidance on that of, essentially the state had said these things can happen if they are changed in such a way that they become moderate or low risk activities. The National High School Association defines sports as high risk, medium risk, low risk, and so the state was saying that if they could modify the games in such a way that met the criteria for moderate risk, like soccer, that they could continue. So we provided some guidance in terms of some of the things that they had already been doing over the summer in terms of some of the camps and tournaments and things like that they had, football had already been involved in over the summer. So that was provided to them. They had a rally up in Hartford the following day, and then I know there was a meeting with DPH, Connecticut Department of Public Health, last Friday between CIAC and the State Department of Public Health. So I know there's still some ongoing discussions at this point. It seems like that the season will not happen at this point, but there is still ongoing discussions. The state has said repeatedly that they are about to put out sort of an overall guidance regarding sports, both youth sports, recreational sports, and high school sports. That has not come out yet. We're waiting on that. In addition, we continue, both the staff, Jill, myself, Santina, Amy, Rob, still continue to participate in multiple CDC, DPH, State Department of Ed conference calls that happen several times a week. And so we are keeping abreast of all the new things that are changing and upcoming. We did this month have multiple meetings with Fairfield U at Sacred Heart in terms of their COVID response team, their leadership there. We've had our contact tracing team has met with both universities as well, specifically to talk about contact tracing and just to sort of make connections face to face and online in Zoom meetings, and just so that everybody knows who the other players are, and to be able to assist each other when needed. So, for example, when Sacred Heart a few weeks back had a cluster of 4 cases that they had set up an extensive number of testing sites available over that weekend, and we're concerned about when all those results came in, if they were any large number of positive cases, if they would have the resources to do the contact tracing for all. And so our staff really stepped up and was available to assist them over the weekends and during the week. And so they did a lot of testing, and a lot of those, there was very few positives that came back from that testing that was done. And a lot of the residents that were testing positive, I'm sorry, there's an airplane flying over my house, hear that. But a lot of the residents that were testing positive were actually Bridgeport residents, so Bridgeport Health Department was also in on those conversations. But that went fairly smoothly in terms of the demands upon Sacred Heart and our department. And so in the first Selectwoman's release newsletter last Friday, we did make mention of, we did have one case in a private school, and that went fairly smoothly. We were able to work with the school to identify all the contacts and to very quickly do the interviews with all the Fairfield residents in that class. It's a private school with a lot of residents from other towns. Actually, the majority of the residents were from other towns, and so we were able to complete the contact tracing very quickly, and the students were picked up very quickly from school. We did get the notification happened of a positive result that happened during school, and the parents of all those involved and the school were notified on multiple occasions about sort of the initially and then some follow-up on some of the questions that they received. So that, in terms of our first school-related case, went fairly smoothly, and so we are, it tested our system, and the system worked, and it went smoothly. We are going to essentially continue that practice. We didn't want to modify anything. The superintendent has indicated that his current plan is, if there is a positive case within the school and the student was in school during the 48 hours prior to him or her developing symptoms, or the test date if the case was asymptomatic, that they would plan to close for 2 days, just to allow adequate time to make communications and to clean the school. And so we feel like we can complete the contact tracing activities in a timely fashion, where that is not necessarily required, but the superintendent felt that that was his preference, that they would close for 2 days and be able to make all the communications in that time. And that's what several of the schools that have experienced cases throughout the state have also done that, closed for a day or two. And so, but some schools have not, and so they've just done the contact tracing quickly and have continued on with the school staying open. I did want to share that we did get the final numbers. I think I shared that we had what's called the Epidemiology and Laboratory Capacity Grant that the state received that has funding for local health departments. So we were able to, we were notified of the award amount for our town, which is over the next 30 months is $252,000. So that will enable us to hire several part-time staff, will enable us to bump up one of our staff to full-time to take the lead on contact tracing, and then have several MPH students or recent grads that are hired on a part-time basis to sort of enable us for evening and weekend coverage for contact tracing. Our current part-timer was offered a full-time position with another health department, and she took that. And so she's moving on. So we want to expand some of our contact tracing capacity with that funds. And so I did want to show you, and I think I see my share screen up there again. So if you can all see my screen now, this is our COVID data page here, just to show you where we are now. So in the town of Fairfield, you'll see we have 762 cases as the cumulative total, 144 deaths, and nearly 600 of those cases are recovered. And so there's some caveats down here, but just to show you some of the data that we have and what we're seeing in terms of reports by date. So this first table you'll see is basically the number of cases we're getting reported on a daily basis, which is essentially ranging since, if we go back to, August, I think that's August 3rd, where we had 6 cases in one day. It's really ranging between 1 and 5 cases most days since then, with 2 cases today. Look at some of these others, and you can see this is cumulative cases over time, and you can see we had a leveling period kind of in here, and then you kind of see the number of cases have started to pick up again. This jump in here is that date that we talked about of that the laboratories did that big data dump, and so there's singular jump there. But then you can kind of see the slope is somewhat increased there with a few more cases. This chart here shows just this is by specimen collection date, so it's a more accurate reflection of when people were sick and when they were getting tested, as opposed to some of the influences of the labs, sort of dumping multiple days of data on one given date. You can see kind of it's been relatively level, with some dips going on over time. We've got some more charts to show those types of things. Here we have our breakdown by age and by sex. You can see that, a significant number of cases are in the 80 plus range, with our average age of 58 overall. We have some interesting data on the school page to show some of the change, or this page actually over here now. But you can see on this chart, this is the by week, the average and median ages of cases, and you'll see during mid-April, we got up to about a median age of 75. That's, half the cases occurring are above 75, half the cases occurring are below 75. And this most recent completed week, we're down to a median age of 19. So a significant change, lots more younger people being impacted. Again, this is the deaths by age group and gender. You can see, vast majority of all these are 60 and over. With the average age of death being 85. And so, and again, I don't want to belabor this. There's a lot of other graphs here that provide some information about, where deaths are occurring, where cases are occurring in elder facilities. This is one that we look to quite a bit in terms of to see the trends. This is weekly cases reported in general population and elder facilities, where you can see there was a peak in cases in the general population, followed by a peak in cases in elderly, and the elderly facility population has for the most part disappeared. And right now we're kind of hovering in this weekly report of 8 to 10 to 14, and this last week, these numbers can change because we're still getting reports coming in. So, but it gives us a sense of are we seeing any significant changes in our numbers? And we're really not. We've been relatively level, since really the end of June. Let's keep going down here. Here's our death by date, and you can see that we haven't had a death since July 12th, July 13th. This shows our positivity rate, just a visual of our positivity rate. So you can see, back in April, there's a larger number of positives for those tested, and right now the numbers that we're getting mostly negatives and very small. Our rate in Fairfield is very low. Here's Fairfield's positivity rate. You can see it's down very low right now. Hover over at 0.64 for the last full week. And we have the symptomology there. We have cases per 50,000. We have Bridgeport area cases, and you can look at that. Just showing what current hospitalization trends with a 3-day moving average trend line. Very low rates of hospitalization. And then I want to jump to, and I'll show you the COVID school data as well. This is a new page that we created just this past month that kind of provides some indicators. We have the back to school metrics that the state of Connecticut set up, and this is just a clip from their document. And then we have two views of this, so you can kind of see all the data. So here's the Connecticut data. You have the leading indicator in the first column, and then the 3 secondary indicators. And this is just a visual way for those who like to see the numbers. If you view going down, you can see the trend there. And you'll see in Connecticut in this first column, we started at 2, went down a little, 1.8, 2.1, 3.1, 3.4. No significant changes, an increase being seen in the state for that's cases per 100,000 population on a 7-day average. And you can see some of the other test positivity is really back in July, it was 1%, and the most complete week it's still 1%. And then hospitalizations and percent COVID like illness seen in hospital ED visits. And I'll show you just Fairfield County numbers in terms of the leading indicator. You know, back in July, it was end of July, early August was 2.5. It's slightly increased up until the third week in August, and then went down 4.3, and then back down to 3.4 this most complete. So it's trending at this point, trending downward. And just while we're told not to rely on these for school decisions, here's Fairfield specific data that we're capturing, not produced by the state. These other numbers are produced by the state, and you can show that, you know, so sort of overall we're trending somewhat level, but down in a downward trend. You know, but again, these numbers, the reason the state says not to use these because they're somewhat more variable because of the smaller data set, and so you'll see that our percent positivity rate kind of is highly variable, with you know being at 1.1 as of September 5th, and I think I shared we were at 0.64 this most recent day. And then just a graphical representation of the same data. We have two staff that are data geeks, and they like both different views of it. And the last thing I want to, a couple things I want to show you is just this is school age children by sample collection date. So you can see essentially, you know, on April 12th, we had a 15-year-old test positive. The 28th, we had an 18-year-old. This is the private school child that tested positive. And then today we had a 16-year-old test positive that goes to school in another town. And so no impact on Fairfield schools. And then I'll show you the last thing, which I think is interesting. So Fairfield Public Schools has put out a dashboard. No, that didn't connect to it. That's connected to the self-checklist. Maybe I touched something. So it's embedded in their homepage. You can see that we have 0 students, 0 staff that are positive at this point, but we do have 12 students and 1 staff in quarantine related to cases in the community, not necessarily related to exposure at school, and with the schools impacted there. And then Fairfield U and Sacred Heart have both put out dashboards that we have links here that show, and I'll just show them real quickly, sort of just you know how many faculty and staff were tested. They're working on, as of last Friday, they had 7 positive cases at Fairfield U and 15. When they say under surveillance, it's in quarantine. And then, and if anybody wants to look at that, there's more data there, but I'll show you quickly Sacred Heart's dashboard, but we have links to all that so that the community can get a feel for what's going on. And Sacred Heart has these different graphics to show their positivity rate. And then this graphic that I think is pretty good of just, you know, how many kids were tested and how many kids are positive. These would be symptomatic students coming to their health center, getting tested, and what they're seeing there. And so, and some of the pre-matriculation testing that went on. So we are, excuse me, Jill is currently working on a dashboard for private schools that we hope to launch in a few days. And so this will provide a full picture of what's going on in the town in terms of the schools and universities. Our staff updates this very regularly. The state is putting out the data once a week on Thursdays, and so the leading indicators from the state get updated. But as you can see, we're putting in data every day. You know, for example, this case was tested on the 12th, but we were just notified of it today, or made aware of it today. So, and then I think that's all I'll share right now, and I'll save, you know, we're working on food clinics, but I'll let Jill share about that if Jill is still on or able to unmute at this point. Thanks, Henry. I'll end it there.
Great, thank you, Sands. Jill, are you on the call?
Yeah, I'm here.
Great, fantastic. Would you mind sharing your report, please?
kind of sum it up for the board. Most of the private schools opened 2 weeks ago, starting August 31st. Prep had some construction delays, so they actually only opened today. All of our private schools are 100% in person, as opposed to the public schools, which I'm sure you know are more the hybrid model. For the secondary schools, the hybrid model consists of a Monday, Thursday, and Tuesday, Friday schedule, with Wednesday being all distance learning, as well as an opportunity, I believe, for the schools to get a deeper cleaning. In the elementary school, the cohorts are based on AM and PM cohorts. So far, we're a week into school and things are going well. As San showed you on some of the data pages there, in the public schools, we currently have 14 individuals on quarantine, no positive cases. And of course, most of those cases were just related to close contact exposure. At the private schools, we have 27 individuals on quarantine, one positive case, which I'm sure you've really read about. And most of those on quarantine are due to, again, close contact in classroom exposure. But we do have some others who had exposure outside of the school setting. Let me see, what else do I want to talk about? At the beginning of the school year, our department provided a lot of training for staff and students. Christine isn't here tonight, but she gave us a great idea to team up with some video high school students. And I worked with them and with Lori Mediotti, who's the health education curriculum, to do videos for the for grades K through 5, K through 6, and then another one for older students at the secondary level. And aside from being really, hopefully informative, it was really a lot of fun to work with those kids over at Ward High School. I also developed a PowerPoint presentation that was given to all staff, and it just reviewed all of the major mitigation efforts that go into having the schools reopen. The nurses themselves, we had a two-day meeting for nursing staff orientation. As I think I mentioned at our last meeting, we were able to bring back all of our part-time staff, which was great. Most of our part-time staff is in the private schools, so they had a lot of catching up to do. We reviewed protocols and procedures for the school health office management, illness notification, and protocols that I can't say were adapted from the state, but we're just training the nurses on Addendum 5 of Adapt, Achieve, Advance, Adapt, and Achieve, the state guidelines. And so far it's working out really well. Putting those things into practice, it's a pretty tight procedure. It really is. And, so far, let me knock on wood. So far it's doing pretty well. I think that Sands and I are really advocating that all of our procedures and protocols closely follow whatever is recommended by the State Department of Health and the Connecticut Department of Education. And I know that's not being universally followed around the state, but I think it's the most reliable framework that we could use to make our decisions about handling these cases. What we do when we get, someone has a close contact in the school, the nurses have been instructed to use an electronic intake form that feeds automatically into a Google Sheet that I can see and just kind of review who's on quarantine, who's not on quarantine, who's coming up, who doesn't have to be on quarantine, who's getting tested, who is not going to be tested and just will remain in quarantine for 14 days. So, at this point with, what do we have? I guess about 40 individuals, it's very manageable. Going forward, that remains to be seen, but so far the procedures and the protocols are working out really well. In terms of staffing, always a chronic situation in our department and more so this year. But actually I've hired about four or five more staff members, and we're only down 3 positions at this point. Every school is covered, but I have a health aide who resigned at the high school, and I'm kind of repurposing our audiometric aide. She's not doing hearing screenings right now, so she's over at Ward High School. One of the nurse coordinators, Eileen Roy, who was with us for over 20 years, she retired at the end of the summer. And the second nurse at Stratfield that we, the new position at Stratfield that we were able to get last year because of the demands of that school, I haven't filled that position yet. Every school has at least one nurse, and secondary schools has their complement of, 2 nurses and or a health aide. So, so far, so good. And of course, I have to tell you that the visits to the nurse's office, at least in this past week, have dropped off dramatically. In the elementary schools, they're still, in one particular day, they still have their almost full complement of students, minus the ones who are doing distance learning. But the visits are few and far between, which is really good because it gives the nurses a chance to catch up on so much of the work that they need to do, be it care plans or 504 preparations, PPT meetings, all distance-based, of course. So it's a bit of a break, but it also is giving them the opportunity to really review all of these new procedures and protocols that we have in place. So it's working out pretty well. The last thing I'd like to talk about is the flu clinic. We have received, I can't say all of our doses for the year, but a lot of it, high dose and the regular quadrivalent doses. On Friday afternoon, we decided to have a morning clinic. Last Friday, we decided to schedule a clinic for this Thursday morning. Every 10 minutes, we can see 4 patients. And I have to tell you, by 9 o'clock this morning, that was completely filled up. So we opened up 5 other more sessions, and those are almost all booked as well. We're going to do these by appointment only, a very limited interaction. We're telling people to get their, forms and consent signs and wear short sleeve shirts and no loitering in the building. You're coming in just a couple of minutes before your appointed time, and we'll see how it goes. So that's Thursday morning. That's the first one, and we have other plans for which Sands is probably more involved in with the drive-through clinic next month. We're just trying to firm up some of those ideas. And actually, that's about it for me. I can't believe I did that in 10 minutes, but that's all that I have for now.
Great, thank you. Does anyone have any questions for either Sands or for Jill? Great. Well, thank you both. Sands, are there any communications?
I have none.
Great, neither do I. Any old business anyone would like to discuss or bring up?
I have none.
All right, hearing none. Any new business?
Nothing on the agenda.
All right. Great, well, thank you. So if there isn't anything else and no one has any objections, can I get a motion to adjourn the meeting?
It's Mary Frances. A motion to end the meeting.
Great, thank you. Meeting adjourned. Thank you, everyone. Hopefully we'll be able to actually see you next month. But you know what? Baby steps. We're getting there.
Yeah.
We'll get there eventually.
All right. Everyone stay safe. Thank you.
You too.
Yes.
Thank you all very
Sands and
much, Jill and
Jill.
Sands. Thank you so much for everything you
Thank you. Yeah. You guys do so much.